All right, so we have the sternum, we have ribs that come around, right? But in between the end of the ribs and the actual sternum, we have cartilage, right? It's actually the cartilage that attaches into the sternum. So we're going to work on decompressing that cartilage away from the sternum at the sternocondral joints, okay? So with this technique, we have sternum literally that goes manubrium down to xiphoid process here, right? So if we take xiphoid out of it and we take manubrium out of it, we're here to here, okay, on her chest. And we want to see, and not that you wouldn't do at the manubrium because you have ribs 1 and 2 that attach into the manubrium, but if we're talking more about the sternum now, we want to see what is the ability for that cartilage to spring away from the sternum, and right here is super compressed onto the sternum, and you can't see because I'm right underneath, but if I was on top, I would be right here. Okay, we just prefer to treat on the skin. So if I come here, I could then use my cascade of techniques that we went over in a different video just to localize this down all the way. Okay, and I'm not going to go through all of those right now because we could do that throughout the entire body and it would be a big waste of time. So watch that video if you are questioning what your options are from a mobilization standpoint. It's the same from soft tissue as it is for joint, okay? So I could get in on this restriction here, and then I could start with just having her breathe. So I'm just decompressing away from the sternum and localizing to that hardest infield. And again, and out. Good, okay? So I could also have her do a little lower trunk rotation. And so I am actually just going to feel myself which way I want to go, and I'm going left rotation, right there, engages into my hands, but it's really further than I really want it to be here, so I'm not going to use that one. I could also have her, what do I want her to do? I think I actually want her to take her right hand behind her head, and then she's going to come up into a little, right there, lazy cobra. And so coming on pressure, off pressure right there. So she can breathe out as she comes up, right there, and then in as she comes back. Yep, and then out as she comes up. So what I'm realizing is that the infield engages when she comes to the maximum flex position, and as she drops down, I'm kind of blocking it from coming back down. So I'm really working on decompressing as she comes up there. And then I could also have her go on a little bit more of a diagonal there versus a diagonal the other way there, and just feel what puts more of an infield. Actually straight on for her brings me the best infield there. Okay, so this is decompressing the sternocondral joint. Another thing I can do here, and I'll show a little bit higher up, although she needs it lower, I think for the sake of the video it'll just be better, is I can actually do a bony contour of the intercostal, or of the ribs, but basically it'd be a soft tissue mobilization of the intercostals all at the same time, just between two ribs, and feel when I find a hard infield, so I'm there, okay, and I can check what depth I want to be at. I actually want to be in a deeper layer here, and then from there I can kind of do a lengthening technique or a shortening technique, but it feels like she needs a lengthening technique to where I can clear some of these intercostals. Go ahead and breathe there, Kelsey. Good, and out. All right, and I could still use lower trunk rotation. I could use the lazy cobra. I could have her go into shoulder flexion. That engages it well. I could have her do a little protraction there. So there's a lot of options that I could use to try and get some of those intercostal muscles to let go. Sometimes when you're trying to decompress the cartilage off the sternum, getting some of those intercostals to let go above and below would be really helpful, okay?